safety and for our patient safety, okay, we should try to always stick with the rules regarding cupping. Hindi basta-basta pwedeng mag-cups. As I've said, it's relatively safe, pero for some people, seeing a possible uh, site of hematoma, kahit hindi siya hematoma, more of petechiae siya, it may mean that the patient is, they may feel awkward and feel distressed kasi, para siyang bruise pag nakita nila. So it's good to know your safety measures and implications, complications, and implications. Okay, cupping is an old term, actually, but the more scientific term would be vacuum therapy or vacuum therapy. Now being used to treat burns and scars. Most of the literatures, marami siyang treatment for burns and scar. Kasi it tends to reorient your collagens and your different fibers for healing. Okay. I'm sure you've seen some of this. If not, these are already some of your silicone cups. It's more expensive than the usual um, plastic cups. They say it's more, sometimes it doesn't stick as well. Okay, but with the um, plastic cups, both Chinese and Koreans are already effective. Pero kung gusto mo ng medyo try pa to, well, it's up to you. Pero based on my practice, it's not as efficient. Ang maganda lang with these cups, hindi sila mas basta nag-focus ng petechiae or cup kiss or yung skinny. Okay, this is the more technology advanced cups. May makikita kayo niyan gumagamit niyan sa mga derma. Usually pag sip ng mga blackheads and whiteheads. But for cupping techniques, this is already being used. Medyo may kamakanan lang. The last time I asked for a price, it's around 21,000. As I said in the previous recording, di ba, may mga kailangan pang research, but these are the modern time researches. Okay? The general effects would be skin lift and distortion. So, if skin mo mas nalilift, nagiging supple. Okay? It also tends to soften the skin and its elasticity. Mas nagiging mas elastic yung skin because of the improved circulation and lymph. Okay? Also, it improves cellulite formation. So, yung mga cellulites na nagpo-form sa skin, sa mga superficial skin level, it aids in the mobilization. Kasi those cellulites are actually blood deprived. So, the best thing to get rid of it is to really exercise na high intensity. Okay? Kasi kailangan mo improve the circulation sa skin. Diba? But with your cups, it artificially improves the skin on the side and the blood circulation and mean on the side, thus giving it more cellulite breakdowns. Okay, it's also used for decreasing scar adhesions. So yung mga nagkakaroon ng scar formation, ginagamitan nito because you tend to reorient your cellulite and your collagen. So mas nababawasan yung keloid formation, and it also improves your epidermal thickness. Okay? Since you're sucking it up, okay, it also increase number of fibroblasts and collagen. Okay? And including alteration of fibroblast phenomenon and your collagen orientation. As I've said, since minimove mo nga, nagiging mas superficial, you now have an outside force to influence your collagen and your fibroblast. So what really happens physiologically when you're using your cups? Given the proper pressure, you created negative pressure dun sa loob ng cup, and then this tends to suck up the skin. So once you suck up the skin, you would see here, right here, di ba? Kung nakikita, okay, let's use a better color. Blue. Okay, kita niyo to, nagkakaroon ka ng sucking up effect, okay, because of the negative pressure. So it tends to lift the skin up. And this part of your skin, okay, keratinized, since nagkakaroon ka ng better circulation, mas nagkakaroon ng better sensibility, or it becomes more supple. And then underneath, makikita niyo itong mga um, mga ibang vessels, lymph vessels, capillaries, blood vessels, okay, that tend to move towards the negative pressure. So you tend to move everything up. Yan. Maangat lahat sila dyan. Okay, lahat nagiging paangat. Okay? So, with this manner, okay, you tend to influence the reticular connective tissues, which is underneath. Diba? You can actually mobilize it. Together with that effect, diba, nagkakaroon ka ngayon ng better circulation because these capillaries and lymph vessels that has skin and that has blood and lymph are moving up, nag-move doon. So now what happens? On the periphery, diba, the body has to maintain some form of, yan, sa mga peripheral areas, sa mga periphery ng area na to, ano nangyayari? The body have to maintain a good supply on those sites. But what happens next? Nagkakaroon ka ng better circulation on those sites that is near the cups. So now, although it might still be under research, okay, these are usual skin reactions. Di ba sabi nga natin, I'm hoping you appreciate already how the cups work. So all you have to do is place it properly and you would have significant effect. Pero syempre, it depends on the patient's skin reaction. Okay? Although it's been taken mostly from Chinese or Oriental medicine, okay? These are your usual skin reactions. Okay? I'm not I'm not going to tell you that your patient will have a tendency for um, for these kinds of skin reactions. But what I'm hoping for is that you would tend to see some correlations between your patient's lifestyle and his reactions. Okay? Okay. Usually, when you put on the cups for assessment, you usually put the cups for like 1 to 2 minutes. Okay. Actually, 2 minutes would be a little bit long. Actually, a minute or two would help you see kung anong klaseng skin meron yung pasyente mo. Okay? But this one here would be always be your healthy blood circulation. Okay? Terminal. Okay. Tanggalin ko konti yung mukha ko ha. Now, with modern stagnation, meaning to say hindi ganun kaganda yung circulation, but still quite healthy, would be like this, modern stagnation. With patients that are really couch potato or really have a, meaning to say wala talagang activity, they would have a tendency for severe stagnation. Patients who are also stressed out would also have such kind of manifestation. Okay, the congestion, okay, congestions and toxin, the purpura, blisters, and black patches, okay, are all signs that there's some possible uh, lifestyle problem yung pasyente mo. Congestion and toxin, medyo may tendency sila for kung makikita mo, di ba? Hindi ganun ka-healthy yung skin nila. Okay? They may be smokers. The purpura and your black patches are often seen with patients with uh, kidney problems or those with stones. Okay? And the blister, which means itong blister, itong blister, yan. Yan yung madalis natin makita, especially if the skin is sensitive or masyadong malakas yung pressure na binigay mo. While those people with possibility for anemia or people who are in a way always that lacks healthy habits, sleep late, eat, doesn't eat much vegetables, or people who are in a way anemic would always have a blood and key deficiency. Okay. So next few slides would be your common response or some we call it mga things that you should be worried about. Okay, a common one among people with bad blood pressure, either too low or too high, would always might have coughing syncope. Ito rin parang usual syncope natin wherein the patient feels nauseated, fainted, dizzy, feels some calm clammy, cold sweats, diba? Uh, the usual solution is also how we usually treat syncope. We ask the patient to lie down, elevate the feet, and then do some upper pumps. So why is it important that you do some testing first? Because there are patients that might not be suited for this kind of technique. One of those is patients with negative effects to cupping. Masyado madaling mag-bruise, okay? Mga pasyente na may tendency nagkakaroon ng feeling ng kinakabahan, okay? Nauseated, nagkaroon lang ng cups, okay? There are those patients with broken bones, okay? Herniation for now, let's put it this way, okay? Kung hindi mo pa alam paano gamitin yung technique for this herniation, huwag mo munang gawin, okay? And then there are also patients with, lahat naman kasi, with cancer, organ failure, okay? Those patients with medyo hindi mo sakop yung practice, okay? And patients that are actually weak, baka hindi sila mag-benefit with your copying, okay? I'm saying this because this is a training, okay? Eventually, you see some patients with cancer who might benefit from this. All you have to do is talk to them properly. Okay? You can actually work on your sleep disc if you work on the contralateral side, but in a stationary position. Okay? You could also not use this because it's your common sense that will tell you that sunburned areas or patients or skin areas that easily bleed, ulcerated, and inflamed easily should not be using pumps. Okay? Also, for your safety, don't use it on patients that are pregnant before their second trimester. Why? Okay? Uh, Anything that happens to pregnant women that's quite significant for them would always be blamed for whatever happens to them. Okay? Uh, Try to work in other areas. Pwede namang mag-work ka on other areas, especially if they have back pain. You can work in other areas, but don't work yet on the abdominal. Okay? Actually, you can use this technique vacuum cuppings with patients that needs more milk eventually. Okay? Pero right now, on the first trimester, or at least the first, before second trimester, let's not use the cups for own safety. Skin is too dry, okay? Don't use cups. Madali sila mag-blister. Use oil. Good oil would be peppermint, grapefruit, okay? Oil or lotion. We use mobilization cream and lotion if the patient has a dry skin. Okay? They do not use it at the stage of skin conditions like burns. Huwag mo kagad lagyan ng cups. Okay? It's a no-brainer, okay, thing that you can use cups. It's a no-brainer thing that you can use cups on skins with inflamed or originally acute, but acute uh, burn areas. Okay? Patients with kidney or liver illness, this is more for your safety. Again, these are, in a way, dreaded disease kung tinatawag sa HMO. So, might as well avoid it if it's not something that you should use for at the same time, patients with kidney and liver failures have a tendency for really tight, inflamed, swollen, may mga edema. So, most of the time, we tend to blister ready. Okay? Mga madali sila mag-blister. Okay? Avoid high pressure or donations for patients with blood thinners, taking blood thinners. Okay? You also don't want to use this on patients with magnet and pacemakers or hearing. No research have shown that it would have an effect, pero just for your safety, your levels right now, try to be discriminate when you are cupping techniques. Okay? And not all claims of cupping might easily be that predictable. Okay? May mga nakikita kayo tulad nito, magka-claim siya ng blood loss, ng weight loss by using Hachima, pero in actuality, hindi natin makuha kung bakit siya nagpo-cause ng weight reduction. Diba? It may not even be an effective. Pwede sinasabi lang na because of some blogging to get people in, they would get some claims and say that, okay, this patient is actually doing cupping for blood, for weight loss. Actually, this is more for blood loss, mawawala kang blood. But I'm not so sure it would cause some weight loss. And even if it's true, I'll be the first one to use it. Okay, okay. For post-treatment expectation after your cup, after you're doing your cup, this will be your usual skin uh, expectations. Okay, the skin will have an increased temperature. So yung pasyente, feeling nila may mainit sa area, ikaw naman, if you feel it, okay, it tends to be a little bit, it tends to be a little bit hot. Okay, para siyang, hindi naman siya febrile hot, pero it tends to be hotter compared with the surrounding other structure. Okay, there's a tendency for red marks, tinatawag natin cavities or the chikinini, pero there should be no blistering. Okay, uh, there should be relief of the so-called petechiae for around 2 weeks. Uh, we're hoping that it will not bruise, pero it will take longer if it has bruises. Okay? With the petechiae is not actually painful. It tends to be sensitive, but not really painful. Uh, the thing is, with the petechiae, there's no tenderness. Pero yung mga pains talaga, or yung bruising, may pain siya. Okay, that's the big difference. For some patients, because they improve your skin temperature, you also improve the temperature and the blood circulation and the lymphatics. There's an increase in bowel movement. So there are patients that have a tendency after cupping to pupunta ng CR. Okay, as I've said, darker red or black is an indication of stagnation of blood thickness. And lymphatic congestions would have a tendency for darker manifestations. Again, guys, take note that the discoloration is not actually bruising. It's actually petechiae, which means it's an improvement actually on the skin circulation. Okay? If it's bruising, there should be skin breakage. If you do it well, there should be proper cupping marks, because this mark or chikinini mark of the cups. Okay? And eventually, the marks would fade away. Usually around 3 to 4 days will start na mag-lighten yan. The patient is already doing cups for a long time, siguro 2 or 3 sessions already, mapapansin nila mas bumibilis yung pagkawala ng cup marks, which means the skin circulation is improving as well. Okay? First session may take longer to resolve, but following sessions would already uh, improve the circulation, thus making the mark time or the kiss mark time or cup mark time shorter. Okay, so these are just some of your complications. There's a tendency for bleeding mole on marks. Well, it might happen because of excessive pressure. Severe bruise, not just your petechiae or skin or your cup kiss or your chikinini. Okay, it may be because of severe pressure, skin irritation. May itong mga pasyente ito usually nagkakaroon ng may sensitivity talaga sa skin. That's why it's really important you need to check it first. Okay, and then patients would have a prolapse or bulging vessel. It's quite okay. Hindi naman magiging problema talaga yan. As long as the skin, there's a bulging vessel, eventually it will subside. And blisters filled with water. Okay? If this happens, you've overdone it. Ang tendency yan na masyado kang malakas yung pressure na binigay. The complication might be infection, so make sure that you really clean your cups. Yung iba talaga nag-sterilizer pa, pero usually just dishwashing liquid, clean it properly, would clean your cups. Broken skin and tearing, sobrang nipis ng mga skin, nag-break sila. So you have to do your testing well. And pain during cupping, maybe because of some excessive pressure. Okay, you just have to lessen the pressure. And then emotional releases. May mga pasyente na nagkakaroon ng psychological release. Okay, bigla na lang umiiyak, bigla na lang nagkakaroon ng emotional outburst, nagagalit. Tinanong mo, bakit po? Hindi nila alam. basta naiyak lang sila, nagalit lang sila, naiibitin sila. And these are emotional releases. They say it's because of psychosomatic. You just have to be careful. Meaning to say, you just have to tell your patient, "Mom, it's okay. It's okay. Just vent out your emotions." The next few slides, these are the things that you should know. Okay, these are what you should do for bleeding moles or marks. So it's more of self-explanatory. You can read on it. So please be guided with uh, what is explained here. Okay, this is now what you're gonna do for skin irritation. All you have to do is just to check the pressure. For patients with health crisis, just let them drink a lot of water, and then there may be something else not related to the cups. So you just have to dig deep. Medyo mga psychologist ang dating dito. That's why you have to get your patient prepared for your pain differentiations. Kaya inuuna natin yan so that you can explain fully well to your patients what's really happening to them based on their pains. Okay, it's not your red mongo for your halo-halo. These are actually a sign of excessive esters. Sobrang lakas ng nilagay mong uh, pressure. Also, this is seen among those practicing heat ventosa or heat cupping. Ilalagyan mo ng apoy sa loob, tapos sasak mo sa skin. Or sometimes they put uh, sort of a candle, okay, moksa, then tatakpan. Minsan hindi na gaano nasusunog yung skin. But I haven't seen this kind of problem. And with God's help, I'm not hoping to experience this myself. Okay? So, pag nakakita kayo ng mga vessels na medyo nakaangat, huwag mo nalagyan ng cups. Pero kung sakasakali man nangyari to, wala namang drain or vessel na sobrang angat. Batas naglagay ka, umangat siya, that's okay. Pero kung talagang nakaangat na yung vessels, nilagay mo pa, well, it could be your fault. Okay? And blisters with water, you just have to tell the patient to drink lots of water. Okay? Ilagay mo na kagad consider mo na kagad ng what's this, ng zinc oxide or blister cream. Okay? And this kind of patients may benefit from your moving cups or from your functional cuppings. Okay? For infections, you should try to put neosporin or your zinc oxide, whatever, uh, dermal or skin ointment that would aid with the leakage of the infection. Okay? For broken skin and tearing, you should ask your patient to hydrate. Baka dehydrated sila. And these patients usually benefit from, before doing this, patients with tight skin or with dry skin, you should put mobilization cream or oil. With pain during coughing, make sure that you don't aggressively do much pressure. Okay? One or two pumps we do for the first time. Kung nakita mo mas naging supple na, naging unlike doing two pumps. Pero pag masyadong sensitive yung skin na nakakaramdam ng patient, lessen your pressure. Pag masyadong mababa yung pressure, nasasaktan pa rin, investigate. Coughing may not be for them. And emotional release. Least expected to nangyayari, but if it happens, just reassure your patient. Okay? You just try to be more confident and compassionate with your patient. Okay lang po yan, ma'am. Try to let it out. It's quite normal for some people, especially with